National Health Department has denounced actions by various groups to blocking foreign nationals from accessing public health care, saying it goes against the Constitution. Now, over the past few weeks, a number of groups, including one called March and March, have barricaded facilities mainly in Gauteng and KwaZulu-Natal to prevent undocumented foreign nationals from being attended to at hospitals and clinics. Now, ActionSA, Member of Parliament, as well as Parliamentary Committee, Portfolio Committee on Health member, Dr. Kgosi Letlape, has asked the Minister of Health whether the department keeps a record of the foreign nationals in the country's healthcare system. Dr. Letlape then joins us now for a little bit more of this conversation. Dr. Letlape, thank you so much for the time. Really appreciate it as well this morning. Let's just unpack some of your thoughts, your reasonings, of course, behind wanting to know this sort of information, considering how long this has now gone on for.
Well, our public healthcare system is overburdened with the numbers of people that are using it. When we go to oversights, when we went to Rahima Musa Hospital on oversight, we were informed that they have 140% occupancy, which means they are 40% over capacity. And when we asked them, they said more than 40% of the people that they see are foreign nationals. If you take foreign nationals out of the public healthcare system, you may begin to cope with the burden. Everybody knows in some clinics, it's reported that as much as 70% of the people attending are foreign nationals. And we're not talking about people that are attending for emergencies. We're talking people that are attending for routine care, for ordinary care. The system cannot cope.
So are we saying then if we remove undocumented foreign nationals who are receiving routine care in South Africa's healthcare system, that figure would reduce at all?
The burden on the healthcare system, on the public healthcare system, would reduce drastically. In certain areas, they comprise more than 50% of the patients that are being seen. And this emanates from two things. One, Section 27 of the Constitution talks about everyone accessing healthcare. That needs to be changed to citizens and permanent residents, just as is a norm in all countries. We cannot afford to provide healthcare services to the globe. It is insufficient for our citizens, for 84% of our citizens that use public healthcare. There's insufficiency. We need to conform to international norms. We need to treat foreigners with dignity, but we need to be pragmatic and realistic in accordance with international law. What is being done can be done. We hear stories of people coming to collect medications and taking the medications elsewhere and running records.
Yeah.
There's absolutely no way this is sustainable. So if the government wants to do this, let them create special facilities or ask them to go to the private sector and the government will pay for them.
Yeah.
But let us make sure that our citizens are given quality healthcare as promised by Section 27 of the Constitution.
All right, so if Section 27 of the Constitution says everybody should receive healthcare, are you then still in support of the kind of blocking and barricading of facilities that prevents undocumented foreign nationals, or documented foreign nationals for that matter, from receiving healthcare in the country right now? Because isn't that then preventing the Constitution itself?
We have submitted a constitutional amendment where it should be clear that there's nothing that we can do for everyone on this planet. It should be specific to citizens and permanent residents. Secondly, on the issue that you raised, we would like the authorities to do their job. Here's what is expected in terms of the law. If you have a foreign national that presents itself into a facility and has been processed by the administration, as a healthcare provider, any person that stands in front of you, you're going to treat them. The administration needs to do the work. In terms of the Immigration Act, anyone that presents themselves that is a foreign national, the institution has a duty to contact Immigration Office and Home Affairs, so that after that person has been assisted, they need to be handed over to the immigration authorities. If the law enforcement did its job, and as ActionSA, we require them to do their job. We require officials at our institutions to uphold the laws of this country and report every foreign national so that the immigration officials can then take over and do their job.
Some might ask that, is the answer not to just create better facilitated hospitals and healthcare treatment centers in the country?
No, that is not an answer. If you think you can pay taxes and have a budget to treat 8 billion people in the world, good luck. This is impractical, this is nonsensical, and it is time we stood up. Now, you have to understand that there are certain things that have been left open and non-specific. Go back to the Freedom Charter. It talks about this country belonging to everyone who lives in it. That may have applied in terms of their understanding 70 years ago. And I would assume that they were talking about the fact that there were citizens that were disenfranchised. Now, we want it to be specific, that this country belongs to all its citizens, not to everyone who lives in it. That is impractical, given the fact that we've had porous borders for 30 years. That cannot be. That cannot be. So we need to go back to ensure that the provisions that were used as a preamble from the Freedom Charter, the Freedom Charter itself is modified. In fact, what we abide by is not by the Freedom Charter. What we abide by is the Constitution of the Republic.
Yeah.
And the Constitution must be specific to give citizens rights that are only to citizens and to treat foreigners with humanity and in accordance with international laws, to ensure that those that enter our country respect our laws. We cannot reward unlawful conduct.
And that's what I'm going to get to then again, because you've already said now that you are already in place to put in a constitutional amendment. You've already put that forward. That's the second thing then, however, is, and I'm still going to hop on to something that I've asked you already before, it is the support for these unidentified people, people who are asking people for their IDs at these healthcare facilities because they're worried about foreign nationals, etc. Are you in support of those actions currently taking place then? Because that's currently what's happening.
We don't want to condone unlawful behavior. But remember, maybe what they should be advised is that they should not interfere with people that need care. But there is a provision where if somebody violates the law and you are in a position to do a citizen's arrest, you can do a citizen's arrest. So when our officials fail to do their job with people that are here unlawfully and are using our system unlawfully, after they've been given the care, they should be detained. Now, when you have authorities that are not doing their job, that are making our country ungovernable, what should citizens do? Should we just sit out there and say, oh, the police are not here, let them kill us, let them destroy our country, let them make our country ungovernable? When authorities do not do what they are supposed to do, they promote vigilantism. You have seen what happens in our townships when police don't act and you have communities take the law into their own hands and suspects get violently handled and killed. So what we have here is a failure to govern this country. What we have here is a failure. And you tell me, when our government fails us, should we let our country be invaded and taken over by people from elsewhere? Is that what you stand for? That is not what we stand for. We stand for the rule of law. But what happens when those that are supposed to uphold the law can't uphold the law?
Doctor, I'm going to ask you
to do?
In my next question, I know it could ultimately lead you to asking me about the other side, but I'm going to ask you this. Are you not worried that we may then be infringing on the human rights and be violating human rights of some sort then for these foreign nationals, documented or undocumented, by denying them healthcare as it currently stands then as well? And I know that there is the other side, which could be the fact that we're denying healthcare to our own citizens as your main worry. But I'm just saying, Would you not be worried that we'd be violating that one side too?
No, I'm worried that we cannot uphold the law. As they come in, they should have health insurance so that they would then be able to access the private healthcare system. Or if they access our system, they should pay for those services. So I'm not violating their rights. I'm saying to them, let them be upright citizens and respect the laws of this country. Let them not invade our borders unlawfully. And when they present themselves here, let them be law-abiding legal citizens so that we can uphold their human rights. I know, even if you are breaking the law, you have rights. And as you will see in Section 27 of the Constitution, at the bottom it talks about no one can be denied emergency treatment. There's no country in the world that has opened itself to non-emergency care for all 8 billion citizens of this planet. This is crazy. And we need to be intentional and clear about that piece of legislation.
Yeah.
So we cannot. I mean, if all of us privileged South Africans that are using underutilized private healthcare facilities are so nice, why are we not saying to them, that's where you go for your care? And you should pay for that care once it is provided. Why is there no provision like that? Why are we trying to be international darlings and domestic pariahs? What is it that ordinary citizens have done that they cannot be protected? We have a similar situation in schools where we have officials saying there's no need for documentation. No child should be denied access to school. Guess what happens? The schools are full and South African citizens can't place their children in schools. They end up finding a place 60 kilometers away.
Yeah.
And their child has to spend 4 hours, 6 hours in a day commuting. You are not developing the child.
Yeah.
It is time we protected the dignity of South African citizens. The Constitution talks about the right to dignity. The way we conduct ourselves as parliament and the way we conduct ourselves as a state, we are not providing dignity to our citizens, and we are concerned about the rights of lawbreakers.
Yeah. Dr. Letlape, appreciate the time. Thank you so much for your words there. We certainly will be looking out for the responses then, of course, from government.